السلام عليكم ورحمة الله وبركاته. السيدات والسادة الحضور الكرام، نرحب بكم في محاضرة اليوم. بداية نتوجه بالشكر الجزيل إلى عمادة كلية الصيدلة جامعة بغداد وإلى وحدة ابن سينا للتعليم المستمر ووحدة التعليم المستمر على جهودهم الكبيرة لدعم هذه النشاطات. I am Assistant Lecturer مريم رشيد عبد from the Department of Pharmacology and Toxicology, University of Baghdad College of Pharmacy, and today I'm glad to discuss with you the main latest advances with regard to toxicological aspects of increased exposure to disinfectants during the COVID-19 pandemic. First of all, I am Mariem Rashid, a graduate from College of Pharmacy, University of Baghdad, with a master's degree in pharmacology and toxicology. I've been graduated in 2021 recently, and today we will talk about an important topic which is related to the COVID-19 pandemic disinfection. Disinfection has been recommended as one of the most effective ways to combat the spread of the novel SARS-CoV-2 viruses to control the COVID-19 infection. However, exposure to disinfectant chemicals may lead to unintentional health consequences to humans. And to discuss these issues, an overview of disinfection protocols along with the different disinfectant chemicals utilized for disinfection, their mode of action and exposure route to human, and the potential adverse effects on human health will be discussed today. The emergence of the severe acute respiratory syndrome coronavirus 2, which is responsible for the COVID-19 pandemic, has led to increased use of disinfectants worldwide. The transmission of this virus occurs rapidly, and it has been reported that during the non-symptomatic and the pre-symptomatic phase of the disease, making this virus unique and unlike other coronaviruses. The major route for transmission occur via direct contact with people who shed respiratory droplets or aerosol that contain the virus particles, and also transmission can occur indirectly through contact with contaminated surfaces and also via fecal-oral routes. Since the virus is enveloped, reports indicate that it is susceptible to various surface-active disinfectants. As a consequence, disinfection and cleaning practices were intensified throughout the world in various private households and public facilities, including hospitals and healthcare settings, public transportation services, college, schools, and workplaces, and with a priority to disinfect highly touched surfaces to ensure proper control of the infection. Infection generally can be defined as a way to kill or deactivate infectious agents outside the living body through application of chemical or physical agents. Although the disinfection recommendations by various regulatory authorities have become less vigorous than the early phase of the COVID-19 pandemic, disinfection is still important in areas which are fully ventilated, crowded with too many people, and occupied by people who may be suspected or confirmed cases of COVID-19 with no access to hand washing and hand sanitizers. Therefore, various regulatory authorities throughout the world have published documents for proper disinfection protocols and provide official lists for various disinfectants which are proved to be effective against this virus. With regard to disinfection protocol, it is necessary to follow the right procedure in order to ensure effective disinfection and to minimize the adverse health consequences associated with exposure to disinfecting chemicals. The first thing to be considered is to make sure that the disinfecting product is effective against the SARS-CoV-2, which is available in various official lists published by many authorities. Also of great importance is to read the product label and to follow the instruction with regard to the proper concentration and the proper contact time of the product to ensure maximum disinfection. Also, it is a prerequisite to pre-clean the surface before application of the disinfecting process and to ensure maximum disinfection efficiency. And also the consumer should wear the recommended personal protective equipment and minimally gloves, safety goggles and face mask are required. And when applying the disinfectant, it is essential to avoid spraying the product directly on surfaces in indoor setting. Instead, it is recommended to use pre-soaked cloth or cotton and light surface to in the indoor environment. And after completion of the required time, it is necessary to remove the glove and wash the hand thoroughly to minimize the adverse health consequences that may result from exposure to even small residues of the chemicals. Unfortunately, large number of people don't follow safe protocol, which increase the risk for adverse events that may be associated with various disinfectants. And one major problem with unsafe use is mixing of these chemicals. With regard to the virucidal chemicals with a proved effectiveness against the SARS-CoV-2, which is the topic of the lecture today, the U.S. Environmental Protection Agency have provided a list called List N, which contain more than 500 products that are proved to be effective against the SARS-CoV-2 virus. These products contain a variety of active ingredients, including Quaternary ammonium compounds or quats, hydrogen peroxide, bleach or sodium hypochlorite, alcohol and mainly ethanol and isopropanol alcohol products, acids like peroxyacetic acid, phenolic compound, in addition to other compounds like iodine and glutaraldehyde. Among these active ingredients, Quaternary ammonium compounds represent the most commonly utilized active ingredient against SARS-CoV-2 virus and present in more than 250 products, followed by hydrogen peroxide, bleach, and alcohol-based disinfectants. These disinfecting chemicals vary in terms of their properties. They are not similar. Hydrogen peroxide and alcohols, for instance, are volatile and short-lived, whereas Quaternary ammonium compounds are non-volatile and have the ability to adhere to hard surfaces and absorb into dust particles more effectively than the volatile products. Thus, these dust may act as a reservoir and a major human exposure pathway for various age groups, especially for children, since they tend to mouth every object during their early phase of their life. With regard to the mode of action of disinfectant, generally disinfectants can be classified either as oxidative agents like sodium hypochlorite, povidone iodine, PI, and hydrogen peroxide, or non-oxidant agents, and the most common among these are the quartz, alcohol, aldehyde like butyraldehyde, and chlorhexidine. Starting with the quaternary ammonium compounds, which are of great importance due to their wide use in a variety of hospital and household settings, since they are present in many cleaners, fabric softeners, and cosmetics. These compounds are salts of quaternary ammonium cations that contain usually a long hydrophobic alkyl chain, and in addition to a small alkyl chain and halide or sulfate group. The most commonly utilized quaternary ammonium compounds are the benzalkonium chloride, or called benzyl alkyl dimethyl ammonium chloride, simply abbreviated as BACs, the alkyl trimethyl ammonium chloride, or abbreviated as ATMAC, and the dialkyl dimethyl ammonium chloride, termed DDAC. Important note that any projects that appear in the following sections are just for educational purposes. We don't recommend or disrecommend any of these projects, but they are only here for educational purposes to demonstrate their widely use or wide availability in Iraqi markets. With regard to the mode of action of quartz, what these compounds act as antimicrobials through the irreversible binding of net positive charge of the quaternary ammonium compound to the negatively charged phospholipid bilayer of the microbe or bacterial cell of the microbial cell wall or envelope. They act in a manner so that the quartz wedge itself within the phospholipid bilayer of the microbe. This will be followed by formation of hydrophilic voids and disruption of membrane functionality, leading to the release of membrane proteins and intracellular components through the formation of quartz phospholipid micelles, ultimately causing cell lysis and death. On the other hand, hydrogen peroxide, which is another widely used disinfectant available in various products in different concentration. This agent acts as mentioned previously as an oxidative agent. It attacks intracellular components through the production of hydroxyl free radical, which will target sulfhydryl groups and double bonds of various highly polymerized structures within the cells, leading to depolymerization of these structures like nucleic acids and cellular membranes. They are used in various concentrations that may reach up to 35% in terms of disinfection of largely contaminated surfaces. On the other hand, bleach, which is produced on very large amounts with very low cost and widely used due to its affordable price and efficiency, it is available in various commercial products and usually used in a concentration of 0.1% for disinfection purposes. Bleach acts by oxidizing the cellular membrane and by breaking down the peptide links in the proteins through to act as an oxidizing agent, thereby to inhibition of enzymatic activity and denaturation of essential proteins and interfere with cell metabolism and leading to microbial inhibition and death. With regard to the mode of action of alcohol-based disinfectant, first of all, alcohol-based disinfectants are widely utilized disinfectant products available in various commercially available sprays, hand rubs, gels, and foams. They are utilized for skin disinfection and also for disinfection of small equipment like thermometers and non-invasive probes. They are usually utilized at concentration of 60 to 70% and produce its effect within 1 minute. It acts by denaturation of a protein and membrane damage, and also it also targets nucleic acid, leading ultimately to cell lysis. On the other hand, glutaraldehyde, which is a broad-spectrum disinfectant used usually in hospitals and healthcare settings for disinfection of surgical instruments and other areas in concentration of 0.5%, and its effect produced within 2 minutes. It acts by interruption with the nucleic acid function and also via protein denaturation. As for iodine-based disinfectant, the most commonly used iodine disinfectant is the polyvinyl pyrrolidone iodine complex, which is usually used for disinfection of surfaces and of skin, for disinfection of the skin pre-operatively at concentration of 7.5 to 10%. It acts by binding to unsaturated fatty acids of cellular membrane, leading to disruption of physical properties of these membrane. Also, it has the ability to react with a nitrogen group of amino acids and are capable of oxidizing self-hydryl group of cysteine, leading to coagulation of a protein and then denaturation. And also, it has the ability to cause iodination of pyrimidine derivatives, leading to destruction of nucleic acids, and thereby leading to cell lysis and death. Overuse of disinfectants throughout the pandemic have associated with increase in exposure to disinfectant through different routes, including ingestion of water, drink water contaminated with chlorine products, for example, orally, or via inhalation of aerosolized liquid particles and dust particles resuspended in air, or through dermal absorption and occasionally through ocular contact, in case usually associated with alcohol-based hand sanitizers. It has been noted that overexposure to disinfectant is associated not only with accidental exposure due to improper use, but also overexposure can occur with proper use of disinfectant, since it has been reported, as previously mentioned, that the air dust may act as a reservoir for various types of disinfectants, in particular quats, and these remain in environment for a long period of time, which poses a health risk for various age groups, in particular young children. The adverse health consequences of various disinfectants vary depending on the type of disinfectant. It has been reported that a number of disinfectants like iodine and glutaraldehyde were associated with low risk of adverse health consequences. On the other hand, some of the most commonly utilized disinfectants have been found to induce adverse health consequences of varying degrees. With regard to quaternary ammonium compound, exposure through inhalation route could cause an airway allergy and could trigger asthma, and it has been recognized that quats act as asthma genes. So this is of particular importance for patients who already have respiratory or allergic disorders, and in such patient group, they should be informed not to use a quad to reduce the risk of triggering of these adverse health consequences. Also, quad has the ability to induce deep lung effects and even lung inflammation at high concentration. And it has been reported that BAC and DDAC can increase the risk of asthma and COPD, and even can predispose individuals to bronchospasm. Another area of concern with regard to use of quads is infertility. In a preclinical study performed using mice model, infertility rate was found to be increased in both male and female mice. And the effect observed include reduction in sperm count, reduction in time and length of estrous cycle, and also it took longer to get pregnant for mice, and also the yield was smaller litter sizes. And these effects were observed at low and ambient concentrations of a quad, which is cautionary for a human. Therefore, it is necessary to study the effects on human fertility following prolonged exposure to the quads. This is of great importance to exclude any adverse effects. Also, quads reports indicate that quads could appear in small concentrations in the blood, and when present even in small concentration, they have been associated with increase in inflammatory cytokine, reduction in mitochondrial function, and could also disrupt cholesterol homeostasis. Cholesterol biosynthesis is essential for embryonic development, synaptic function and formation, and also for neuronal myelination. And anything that interrupts cholesterol biosynthesis could trigger congenital malformation and defect in neuronal development. The quads have been found to have the ability to bind to active site of enzyme called 7-dehydrocholesterol reductase, which is required for cholesterol biosynthesis. And by binding to this enzyme, it can inhibit its activity at non-cytotoxic concentration. And also, it can cross the blood-brain barrier in rats. And this is very important finding. The increased use and exposure to quads during the pandemic need to be thoroughly investigated to understand the potential threat to neuronal defects in young children, and to study the effect of these agents on pregnant women. Also, skin irritation have been also reported with use of quads. and it is shown that Quat has the ability to disrupt the protective lipid layer of the skin and thereby increase the absorption of toxic substances through this disrupted skin. With regard to bleach, which is the most commonly used antimicrobial agent in various household and public places, indoor bleach cleaning have been associated with the release of elevated levels of hypochlorous acid and chlorine gas at up to several order of magnitude greater as compared to the outdoor atmosphere. And this will result in elevated exposure to these toxic gases and poses a great hazard to general public and professional cleaner who are especially susceptible to our exposure to chlorinated products that are released during indoor cleaning. Exposure to bleach-based products have been associated with increased risk of COPD and also might also trigger asthma. And importantly, in combination with other chemicals like ammonia and toilet bowl cleaners, bleach-based products can release the release of chlorine gas, chloroform, and carbon tetrachloride to the environment, and these gases, if inhaled, can lead to severe respiratory health damage. When come in contact with most tissues like lung and eye, has the ability to produce hydrochloric acid, which is a digestive molecule that can damage airways, leading to asphyxiation and death. Furthermore, acute exposure to bleach at usually utilized concentrations have been associated with increased incidence of bronchospasm. Therefore, precautionary measures should be taken when using bleach-based products as a household and industrial cleaners. On the other hand, hydrogen peroxide have been also associated with increase in the risk of COPD and reduction of asthma control, but however, it can associated with mild gastrointestinal adverse events at concentration of 3% or less, and also hydrogen peroxide can cause a mutagenic effect through induction of DNA and protein damage at concentration of 30% and can be life-threatening at a concentration of 75 parts per million. As for alcohol-based disinfectants, this group of products carry the lowest risk of adverse events as compared to other widely used disinfectants. Increased exposure to alcohol-based disinfectants via inhalation have been associated with increased risk of COPD and reduction in asthma control. However, large amounts and prolonged exposure to alcohol-based disinfectant in non-intact skin is required for systemic toxicity to appear. With regard to reproductive risk of alcohol-based disinfectant, researchers have found that it is negligibly small. And long-term exposure to alcohol-based disinfectants can increase the risk of asthma, COPD, and other respiratory issues. Importantly, skin complications might also occur with the use of alcohol-based disinfectants. And these dermatological complications may range from simple dryness or cutaneous cirrhosis 2. Irritant contact dermatitis, which require which might pose a risk for people who are already with a dermatological disorder. Importantly, although these group of disinfectant products appear to be associated with lowest risk as compared to others, these products have been associated with increase in the risk of poisoning in preschool children through accidental ingestion of hand sanitizer. This may be attributed to the fact that majority of alcohol-based hand sanitizers resemble food and drink products. They often present in colorful dyes and have attractive scents. All this may be appealing to children, leading to significantly increased exposure to this product through ingestion in small children. However, the effect associated with exposure to these products are usually mild ocular effects like conjunctivitis or mild gastrointestinal effect or mild CNS depression effects. Only few cases require hospitalization, suggesting that these products are generally well tolerated. However, this is true for ethanol and isopropanol containing products. On the other hand, methanol containing products are extremely dangerous, and various cases have been reported to occur in which methanol containing products have been ingested, and the result were very detrimental, ranging from permanent visual impairment to even death. So, given the importance of disinfection in the control of the COVID-19 pandemic, the increased use of disinfectant has been essential to battle the battle against the COVID-19. However, proper disinfection is required to minimize the adverse events associated with these products. And a number of recommendations have been suggested by experts to reduce the adverse effects associated with these disinfectants. Of particular importance is the utilization of proper precautionary measures, including proper personal protective equipment and to be worn by consumers while preparing, diluting, or applying the disinfectants. It's also essential to apply the disinfectant in a properly ventilated places. The disinfectant and its concentration is carefully selected, and also it is essential to avoid combining a number of disinfectants, since this may be associated with the release of dangerous gases like chlorine and leading to destruction of tissues. Also, hand washing after handling of disinfectant is important to remove any residual molecule of these chemicals on the skin. And the children should be kept away from reach of these products, and also they should be kept away during application of these products. Importantly, the lids of after preparation or dilution of the disinfectant products, it is important to close the lid and label the container appropriately. That's because these products are usually colorless, and improper labeling or keeping the lids open might contribute to spillage of these containers, spillage of these solutions, and also misuse of these products. It is important to warn the general public of the risk of poisoning associated with surface disinfectant and hand sanitizers, and also it is necessary to supervise the children access to any alcohol-based disinfectant product to minimize the risk of ingestion in this age group. In conclusion, continuous use and overuse of disinfectant could have short and long-term adverse effects on human health. These effects need to be investigated thoroughly for various products, since the toxicological data are lacking for a large number of these products. Also, safer handling of these disinfectants is essential to mitigate the potential hazard, and thorough research on effect of quartz and other disinfectants on human fertility, pregnant women and young children, neuronal development is warranted. Thank you for your listening. I was honored by your attendance. Any questions?
دكتورة تيسير تفضلي عيني.
السلام عليكم.
عليكم السلام ورحمة الله وبركاته.
طبعا شكرا جزيلا على المحاضرة الحلوة كلش، وبصراحة موضوع شيق كلش. بس حبيت سؤال، شنو ذكرتي واحدة من المخاطر هي الانفيرتيليتي، حبيت أعرف which type of compound cause infertility and if you know the mechanism please. Thank you.
The most infertility have been reported with the Quaternary ammonium compound, and in fact the compound that have been studied and found to possess infertility effect is the DDAC, which is abbreviation for dialkyl dimethyl ammonium chloride. This compound in particular was found to reduce sperm count and also to reduce infertility and took longer to get pregnant for female mice of the studied animal, took longer period to get pregnant. And the mechanism is uncertain. It haven't been demonstrated yet, but the effect was reported.
دكتور خالد تفضل. دكتور خالد.
شكرا. السلام عليكم.
عليكم السلام.
شكرا دكتورة سدية. أشتيد دكتورة مريم عن المحاضرة الحلوة اللطيفة بالحقيقة. يعني quick review للديسنفكتنس، قسمنا كثير من الديسنفكتنس، يعني أنا شايف فيها الصراحة زين، شوفتيناها بالصور. أول طبعا شفت العنوان رأسا ذكرت الرئيس ترامب بالحقيقة بداية البانديميك من اقتراح injecting bleach، وكان يعني سيريس بهالموضوع. فبعدين
اي فعلا صح، شلون نسيت.
كان شو اسمه يعني he made a joke of himself anyway. سؤالي، انت طبعا غطيتي الموضوع يعني الميكانيزمز ما شاء الله، والبرسنتج والروتس اوف اكسبوجر اتسترا. بالنسبه للايزوبروبيل الكحول والايثانول، يعني these are widely used حقيقه. حتى كان يعني عاده الايزوبروبيل الكحول ما اعرف ليش يعني برا بامريكا، ما اعرف بيوروب يعني اكثر commonly used من الإيثانول. هل هو يعني ما أعرف إذا أكو بسبب الميثانول اللي قد يكون بالإيثانول أو يعني سبب آخر. إذا كنت if you have any information about that. وأريد أيضا عندي comment بخصوص الهاند سانيتايزرز. إذا تذكرين دكتورة مريم مرة طلع ريبورت قال الهاند سانيتايزرز يعني أخطر من الهاي سبرايز نوعا ما، كونها يعني والجلز longer contact time with the skin، وهذا ممكن يعرض لنا more time للميثانول to be absorbed ويسوي المشاكل اللي أنت ذكرتيها. أنا هسه الحين يعني ما أعرف إذا عندي any recommendation isopropyl alcohol أو إيثانول. شكرا جزيلا.
شكرا دكتور، شكرا جزيلا على المداخلة الحلوة. طبعا هو المصادر اللي اطلعت عليها إنه الآيزوبروبيل الكحول والإيثانول يعني have similar effects. No one is superior or inferior to the other. Both are associated with a good safety profile generally, but long-term exposure may be associated with the toxicity. The toxicity, even the toxicity are minor. يعني toxic effect ماله minor، مو كلش قوي مثل الكواترنري أمونيوم compound، يعني هي non-volatile و usually require large concentration and long period of exposure to get access into the systemic circulation. However بالنسبة دقيقة، هو السؤال كان ايزوبروبيل هذا بالنسبة عفوا دكتور شنو كان
يعني هو كان يعني ممكن يعني كان which one would you prefer يعني isopropyl alcohol methanol or
يعني أنا مش أي document يأكد إنه واحد is superior to other، بس هي طبعاً the preferred approach إنه هو washing hand with soap and water, since these are rinse-off products. والrinse off product is preferred over preferred over the gels and other alcohol-based disinfectants. لأن الجل as you mentioned تبقى contact time مالها for long periods، بينما الديسانفكتنت سوب والواتر يعني تأدي الغرض وبتبقى على السكين for long period of time، فما تسبب لي لا disruption بالانتجريتي مال السكين ولا تعرضني ل elevated exposure مال these agents. بس
شكرا جزيلا. أنا ما أريد أطول على الآخرين. شكرا جزيلا.
شكرا جزيلا دكتور. شكرا لكم. ماذا أخرى؟
الو مرحبا.
هلا ومرحبا، اهلا وسهلا.
دكتورة مريم، شكرا جزيلا على المحاضرة الحلوة. عندي سؤال على يعني الانسيدنس هاي اللي صارت ويا البانديميك، الزيادة أو أقفد إحصائية بالنسبة للعراق بالعالم، إذا كانت أكو مثل ما يقولون زيادة، وش قد مقدار الزيادة اللي صارت بالنسبة للتوكسيسيتي اللي ويا البانديميك from the use and overuse of the disinfectants. حتى نعرف seriousness, probably maybe people are more aware about the toxicity of these disinfectants. So probably there is no too much increase in the incidence of the toxicity. So do you have any data or figures about the incidence of the toxicity associated with the pandemic?
Yes, if we visit the various websites, mainly through طبعا دكتور شكرا جزيلا على السؤال، شكرا جزيلا. Available data for increased exposure to toxic level of or to overuse of disinfectant موجودة هواية. Unfortunately هاي الداتا موجودة outside Iraq, not in Iraq. واكثر شيء الداتا المستحصله هي من الكنديان سنتر for disease for infection control and also for من ال Center for Disease Control and Prevention باليونايتد ستيتس. هواية اكو حالات ingestion مال alcohol based hand sanitizers especially in young children. شفت هواية بيبرات على هالموضوع، وحقيقة البيبرات ما كانت مقتصرة على يونايتد ستيت، اكو بيبرات بكرواتيا، اكو بيبرات بكندا وورلد وايد وايضا بالصين. فالاكسبوجر بالذات واكو ايفيدنس عليه واكو ريبورتس موجوده. يعني اذا نروح هسه على جوجل سكولار او على الريجولاتوري اوثوريتيز ونشوف الاحصائيات مالتهم راح نشوفها موجوده. حاليا ماكو فيجر جوا ايدي، يعني انا خازنتي انا عندي دوكيمنت جوجل سكولار ما ادري عفوا بالمنزلي ما ادري هسه اقدر افتحها لو لا، بس موجوده يعني الاحصائيات كلش هوايه. والريكومنديشن list for various regulatory authorities يعني contain detail about the proper use of disinfectants, about the effect of these disinfectants both short term and long term. وهاي الليست تحتوي على continuous updates، يعني دا يحدثوها بشكل مستمر دائما. احنا اكثر يعني اكثر موقع احنا نزوره هو ال EPA مالت اليونايتد ستيتس. هذا الليستات مالت الريكومنديشنز مالته دائما updated، والليست مالته دائما updated، وتقريبا يعني كلش يوفي ويحتوي على كل التفاصيل.
شكرا.
شكرا لكم.